Hello, welcome again. My name is Dr. Scott Seidenbach. I practice in Omaha, Nebraska. What I want to do today is show you some different information and I'm going to kind of show you a sample treatment and how that process goes. So what we look for is we look for weakened areas within your nervous system. Now when an area is weak in your nervous system, what will happen is there's an area here we call the middle brain. If the middle brain isn't controlled, so if the signals aren't kind of suppressed, if something's weakened around there, that middle brain will overfire. When that middle brain overfires, it'll start to go kind of crazy here and overstimulate a lot of areas in the nervous system. So if it stimulates a lot of areas up here, it might trigger the blood vessels in the brain or areas to constrict, which would trigger, headaches. It can affect different areas. So what I want to do is just show you like a sample examination, what we look for, and then how we repair that or fix that. So we're going to use a kind of a fake patient, but what I want to do is we're going to find, just for example, we're going to look at what's called the cerebellum. So we're going to say, for example, someone comes in our office, has a weakened cerebellum. If the cerebellum is weak, it won't suppress that middle brain, so that middle brain will overfire, like I said, trigger, let's say, migraines. So if we find someone during evaluation that has a weakened cerebellum, that person might have, symptom-wise, they might have like dizziness. They might feel kind of off-kilter, because the cerebellum controls the posture in the body. Now the cerebellum also controls all the muscles in the backside of the body. So someone with a weak cerebellum might have chronic neck pain. They might have pain on the arms. They might have sciatica or pain down your legs, low back pain. All that type of condition because it controls the muscles here. If those muscles are weak in the backside of the body, you're going to irritate the nerves and create pain. Now this also has connection to the eyes. It affects the eyes, but we won't get into that much here. But we're just going to say, for example, we found in this patient that the cerebellum was weak. During the evaluation, we found them kind of moving around with their eyes closed. They can't touch their nose. They have muscle tightness, muscle soreness. I mean, everybody can have different stuff, so not everybody has to have the same stuff. But those are some of the signs of a weakened cerebellum. So if we find a weakened cerebellum, which is allowing the middle brain to overfire, which triggers the headaches, we'll do certain therapies to strengthen the weakened part. Now there's a left side and a right side. So let's say the left side of the cerebellum is weak. We're going to do stuff on the left side to strengthen the left side. So we might use vibration. So the patient might lay down on their back. It vibrates the back side of the body here, stimulates the cord receptors, and starts to recharge the cerebellum. Now we might use a stimulation effect on the left side of the neck there. And it doesn't hurt, trust me. We might use what we call a unilateral adjustment, which stimulates other areas of the nervous system tracts. We might use something on the left side here, like a rowing motion. We might use eye exercises. We might use, there's a thing called a chloric, where we put water in the ear, which stimulates the nerves in the ear. There's different techniques we can do to strengthen the cerebellum. So when we start to strengthen that cerebellum, the left side compensates for the right side, and that'll allow us to suppress that middle brain and start reducing the overfiring, which will obviously reduce the triggering of the migraines or headaches. That's how if somebody comes in with a cerebellum problem, or we find that during an evaluation, we can start to repair that so the headaches will go away. Now, not everybody coming in has a cerebellum problem, so don't assume that. I'm just showing you an example of what we do when we find certain areas that are weakened. There's tons of different other areas we can find. We can find a lot of other stuff. We can find herniations or bulging to the spinal cord, which affects the nervous flow. We can find weakened areas up in the front, which affect, maybe you might have short-term memory loss. Anyway, so I just want to show you just a basic, quick thing of what we do when we find certain stuff, how we do it. And I said all the stuff is natural. And like I said, you can read the free report here. If you have any questions, please give us a call, and we hope to see you soon. Thank you.